Hematology Introduction.
Hematopoiesis starts in the yolk sac. In third week of the intrauterine life. Liver in the third month of the intrauterine life. Bone marrow and liver in the fourth month of the intrauterine life. Bone marrow just before birth. Hematopoietic stem cells are classified into two: common lymphoid progenitor and common myeloid progenitor. T lymphocytes, B lymphocytes, and natural killer cells. Neutrophils, eosinophils, basophils, monocytes, RBC, and platelets. Peripheral smear. Stain used is Romanovsky stain. Leishman, Giemsa, Wright, Jenner. Bone marrow examination. Bone marrow aspirate and bone marrow biopsy. Most common site of bone marrow aspirate or biopsy in adults is posterior superior iliac spine. Other sites: iliac crest, anterior superior iliac crest, and sternum. Most common site of the bone marrow aspirate in children are sign of Tibler, bone marrow needles, Schaller's needle, and Kilmer needle. For bone marrow aspiration, Jamstrides needle, bone marrow aspiration, and bone marrow biopsy. Normal myeloid erythroid ratio is 3.1 to 15%. Percentage of cellularity of bone marrow biopsy is 100 minus.
Age of the patient.
WBC disorders. Normal total leukocyte count is equal to 4,000 to 11,000 cubic millimeter. WBCs are two types: granulocytes and agranulocytes. Neutrophils, eosinophils, and basophils. Lymphocytes and monocytes. Non-neoplastic disorders of WBC. Leukopenia and leukocytosis. Low WBC counts are usually due to neutrophils. Causes: drug-induced, aplastic anemia, neutropenia, neutrophils less than 1500 per UL. Agranulocytes are clinical significance in neutrophils. Severe infections occurs when the neutrophil count is less than 500 per UL. Reactive proliferation of WBC. Examples are neutrophilia, eosinophilia, and basophilia. Neutrophilia. Increase in neutrophil count. Normal is equal to 40 to 70%. Causes: acute infections, bacterial infections, tissue injury, or Burns MI, myeloproliferation disorder like CML, eosinophilia. Normal eosinophil is equal to 1 to 6%. Causes: allergic reaction, heavy fever, parasite infection, drug reaction, malignancy like Hodgkin's lymphoma, tropical pulmonary eosinophilia, basophilia. Normal less than 1%. Causes: CML and ulcerative colitis, lymphocytosis. Normal lymphocyte is equal to 15.40%. Causes: chronic infection, tuberculosis, viral infection like EBV and Hep B, malignancy like CLL and non-Hodgkin's. Monocytosis. Normal count of monocyte is equal to 2 to 8%. Causes: tuberculosis, rickettsiosis, endocarditis, and inflammatory bowel disorders. Toxic granules and dull bodies. In sepsis, or infection on peripheral smear. Toxic granules and dull bodies. Coarse and darker than normal granules. Patches of dilated endoplasmic reticulum. Appears as bluish cytoplasmic puddles.